Why is undiagnosed PEI so common? Imagine feeling bloated or having greasy stools and not knowing why. Many people experience these symptoms but never realize they might have pancreatic exocrine insufficiency, or PEI. The reason it often goes undiagnosed is because its symptoms are so common and overlap with other digestive issues. Conditions like irritable bowel syndrome or general malabsorption can cause similar signs, making it tricky for doctors to pinpoint PEI right away. Another challenge is that PEI can be mild in its early stages. When the pancreas isn't producing enough enzymes, symptoms might be subtle or absent, especially in the beginning. This makes early detection difficult unless specific tests are done. Plus, there isn't a single perfect test for PEI that everyone uses. Some tests, like measuring fecal elastase, can miss mild cases because they aren't always sensitive enough, especially if stool samples are not ideal. Many healthcare providers might not be familiar with the best ways to diagnose PEI or might not think to test for it unless symptoms are very clear. PEI is often linked to pancreatic diseases like chronic pancreatitis, pancreatic cancer, or after pancreatic surgery. But it can also happen in people with other conditions like diabetes or after certain gastrointestinal surgeries. Unfortunately, doctors may not always consider PEI in these situations, so it can be overlooked. When pancreatic cancer is involved, the disease itself and the treatments can cause or worsen PEI, but sometimes the focus is solely on managing the cancer, and the signs of enzyme deficiency are missed. Lack of awareness is another big factor. Patients might not report symptoms, thinking they are just part of aging or other common issues. Healthcare providers may also not be fully aware of how often PEI occurs outside of pancreatic disease, leading to missed opportunities for diagnosis. Education about PEI is improving, but it's still not routine to screen for it unless there are clear signs or risk factors. In people with pancreatic cancer or after pancreatic surgery, PEI is very common. Yet many of these patients don't get tested or treated for it early enough. Without proper diagnosis and enzyme replacement therapy, they can suffer from malnutrition, weight loss, and a lower quality of life. This can even affect their overall prognosis. The bottom line is that many factors contribute to why PEI remains undiagnosed. Its symptoms are nonspecific, testing can be tricky, and awareness among both patients and doctors needs to improve. Routine screening in high-risk groups, better education, and following established guidelines can help catch PEI earlier. This way, patients can get the treatment they need to improve their digestion, nutrition, and overall health. If you or someone you know has digestive symptoms or pancreatic disease, it's important to talk to a healthcare professional about testing and management options.